there's a saying in dentistry, like dentistry is not expensive, but neglect is expensive.
People including me, இப்போ எனக்கே வந்து டென்டல் டாக்டர் கிட்ட போனோன்னா there is ஒரு deep seated fear, I think.
The patient says, doc, I'm sorry, but I hate dentists. Some people have deep-seated psychological issues. Avungalukella we plan sedation.
What can a person's mouth actually tell you about them regarding their life as such?
And very often we are the ones who tell diabetics that they are diabetic.
Seriously, smell வச்சே வந்துட்டு diabetes இருக்குன்னு கூட you can detect.
Tongue cleaning is recommended, especially if there is a perception of bad breath. So bad breath usually starts from the gut.
Morning brushing is for your
Friends.
And night brushing
For
is
your teeth.
for your teeth. So it is that important.
Dr. Varun Acharya is a dental surgeon, smile specialist, and advocate for preventive oral health. He earned his BDS from Savitha Dental College, completed prosthodontic training at New York University College of Dentistry, and pursued a fellowship in maxillofacial prosthetics and oncologic dentistry at MD Anderson Cancer Center in Houston. He has published in international journals and lectures nationally and internationally.
So what is this oral microbiome?
Preterm birth weight, the low birth weight and premature deliveries, all of those things are related to poor oral microbiome.
So tooth tablets,
See, effectiveness is a question.
flossing.
Flossing is a very, very good thing because நம்ம brush பண்ணும்போது பல்லுக்கு நடுவுல clean பண்ண முடியாது.
It's an ancient practice in our country, our side of the world especially, is oil pulling, right?
So I don't recommend oil pulling.
Night paste and day paste, no difference. I guess you can use
I
one
have
paste.
to go into the marketing material and see if there's a real difference.
Okay. That there is apparently all these color marks on toothpaste tubes.
No, those black dots are just manufacturing indicators for when the machine has to cut the box.
Yeah.
But it has nothing to do with any type of indication of what is in it. Social media has given a lot of time to everyone.
Yes. They seem to blow up and go viral, though they may
Absolutely.
not actually be true. Brushing hard means cleaner teeth. If there is no pain, there is no dental problem. Mouth spray is effective for prevention of cavities.
That's 100% myth. No,
Whitening toothpaste, fact or fad?
I would say more of a fad.
Using a toothpick,
It is dangerous.
if teeth could talk, what would they say?
Don't take out your aggression on me.
Hi and welcome to another episode of Femiliarise. Let's get the conversation started. They say the eyes are the window to the soul, but did you know that the mouth is the mirror to your health? Every person's mouth tells a story. After all, we have the mythological story of Lord Krishna opening his mouth and his mother seeing the whole world inside. Though not the whole world, your dentist may actually be able to tell a lot about your life and health, your habits, your hormones, your stress, and even your heart by looking into your mouth. Yet for most of us, dental care stops at brushing twice a day, or for most people once a day, I would say, until something hurts. Today on Femiliarise, we are getting to the root of it quite literally with Dr. Varun Acharya. So I'm sure he's going to be the best person to decode the fascinating world inside our mouths, the oral microbiome, the real way to brush and floss, and how stress, diet and hormones changes our gums, and why our mouth is truly the gateway to the rest of the body. So whether you're sipping your morning coffee, smiling for a photo, or teaching your child how to brush, this episode just might make you look at your teeth and gums a little differently. Because your mouth doesn't just speak, it reveals. Welcome, Dr. Varun.
Thank you so much, Dr. Priya.
So, what is the percentage of patients who actually come in for a preventive dental check in our country, and what is the actual recommendation?
So, the preventive dental check recommendation for a normal, healthy patient who doesn't have any other comorbid conditions, who doesn't have any other issues whatsoever, the standard everyday patient, right, is every 6 months.
Okay.
The challenge is in our country, especially, this seems to be almost when I have a problem is when I'll go to the dentist. That is kind of the approach. Now, the problem with teeth, or the thing about teeth is, we have the outer enamel layer, which really don't feel sensitive even if there's a big cavity over there. It's only when that cavity crosses the enamel layer and heads to the dentine, that's when the nerves get involved, and that's when a patient reports pain. But now at this point, the damage is done. It may be a large crown, it may be a deeper filling, it may be a root canal treatment that's required. And in worst cases, the tooth has to be removed and we have to plan the replacement. So I would say in India, unfortunately, that every 6-month protocol is not being followed by most patients. It's more of a I'll deal with it when it happens. So I would say on average in India, people are doing about 1.5 to 2 years as a more common time to visit the dentist. My patients who are not from India, my expat patients, are much better at this. They would come every 6 months. I think it's also a reflection of how expensive dentistry is abroad. They do understand that waiting a long time on a certain problem is going to amplify that problem.
Yes,
You
make
know,
it
they
more expensive too.
exactly. So there's a saying in dentistry like dentistry is not expensive, but neglect is expensive. Because for the earlier preventive stuff, even something like a small filling is not so expensive. But if you wait long enough, now you're placing an implant, and now the cost has
Blown
increased
up,
10
yes.
times at least.
So actually, yes, because I think it's also like preventive health checks, preventive dental checks are really not done, and no one really bothers about our teeth. That is the sad truth, I would say. So if you ask me whether a person who believes in preventive care, whether I actually go in for my preventive dental checks once in 6 months, and we have a dental clinic right there in our hospital, and we do not, but doing the research for this episode, I think I might change my mind.
I'm
for
glad to
sure.
hear it.
People including me, இப்போ எனக்கே வந்து டென்டல் டாக்டர் கிட்ட போனோன்னா there is ஒரு deep seated fear, I think, that may come about because of some adverse childhood experiences with the dental doctor being a little rough or something like that, or வந்து when you go to the dentist, even that அந்த cleaning இருக்கு இல்லையா, so அந்த when they use that machine, that sound and even the sound of the drill being used, all that is like very very scary, I should say. So is that a reason that people don't go to the dentist that often? Is it because they are somehow scared about opening their mouths, and it makes you, it's like going to the gynec, I guess. No one really wants to come, right? And it makes you a lot vulnerable, I guess. So again, is that a whole is that a main reason?
So I think that's changing. I think in the past, what happened was concepts of like painless dental anesthesia and empathy for the patient, all of that may have been few and far between among dentists. It was an attitude of no pain, no gain. Okay, and this scared the entire generation of the population and made them fear dentists. In fact, it's very common that on Monday morning we start our schedule and the patient says, doc, I'm sorry, but I hate dentists. Like, it's a very very normal thing for us. Okay, this is the to face that negativity in the morning. We're so used to it, it doesn't even feel like anything anymore. But nowadays things are changing. Now we deliver painless anesthesia. There are so many different techniques to essentially distract the brain from even realizing that needle prick happened. This is one thing which has changed a lot. We give a lot of breaks to patients. We make sure that they're comfortable throughout the procedure. We don't stretch procedures for very long. There are a lot of things which are done to improve the comfort level of patients. So I've noticed in my phobic patients, first வரும்போது அவங்க ரொம்ப பயப்படுவாங்க. They are very sort of find it very difficult to get anything done. Second visit length, they are a totally different person. There is a totally, and sometimes I ask them, நீங்க first visit ல அவ்வளோ பயம் இருந்துச்சு உங்களுக்கு, ஆனால் now you are like a totally different person. What happened? It's like, no, now I'm used to it. It's fine. Now I don't have that phobia. So this happens a lot. But it's all about how we approach the patient. This no pain, no gain concept has to be thrown out the window, especially in dentistry, because it is such a vulnerable position.
So speaking for myself, I think when I was pretty small in school, my mother, I had a cavity. அது ஒரு சின்ன டென்டல் கிளினிக் இருக்கும் நியர் அவர் ஹவுஸ். ஸோ ஷீ டுக் மீ தேர், and he was a little a little rough, right? And அப்பெல்லாம் you had only these amalgam fillings.
Yeah.
So something he did, and he took the drill, he did something and put. So I think that put me off dentist right there. And you sort of do remember all those things at the back of your mind. But when the patient comes with fear and you're able to really convert them, that should feel very satisfying, I'm sure, right?
It does, because then it sets them up for a lifetime of, sort of healthy dentistry. Healthy dentistry, I mean not going in when there is a problem. They are not so scared now to come in for their regular checkups and get things done. And routine work is not an issue at all. So yeah, it is very satisfying.
So I always tell patients, because gynecanaale ஒரு மாதிரி they have this sort of negative association and sometimes ஒரு terror-ஆவே இருப்பாங்கன்னு சொல்லிட்டுன்னு. So dentistry has changed and it is more towards patient comfort and painless anesthesia procedures, as you said, not necessarily large needle and
Correct.
you're scared and you're looking at it and things like that. So again, things have changed, so people should again go and make up their mind for themselves.
So there is one small alternative to the truly phobic patient. Okay, so some people have deep-seated psychological issues. Avangalukella we plan sedation. So we do sedation. Usually IV sedation is what we prefer. Also, a lot of people practice with nitrous as well. But IV sedation is something which we can do up to 3 hours as a safety limit for IV sedation. We have a trained anesthetist available. And there are those patients for even a scaling, which is the cleaning, which you hear the sound of the ultrasonic. They're so sensitive, but they want to get it done because they feel the need for it also. Even for some simple procedures like that, in the rare cases, maybe once or twice a year, just for a cleaning, we get it done under IV sedation.
anesthesia if
But
necessary.
yeah, but they are very happy to get it done because the IV sedation also brings in some amount of amnesia. So they don't remember that the procedure was done. So this is, something which they also, for us, it may be a little more challenging to deal with these IV sedation patients because they are quite lazy. They are awake, but they are lazy. If you tell them open your mouth, medua tarakwanga. They'll do it slowly and they
and
won't
you can't
do it.
do it for them.
We do put a mouth prop, we do all that, but the responses are very delayed. So for us, it's a little more challenging, but definitely not as challenging as someone who's highly phobic. So yeah, this works better.
So there are options available for
Very
people
much.
who are very scared too.
The same option for people who gag also. Some people have a very severe gag reflex. You just touch the tongue and they feel like they want to throw up. For these people, IV sedation, without a question, works perfect. Yeah.
So what is actually inside our mouths? What do you think? I mean, obviously it is the tooth. Other than that, what do you think we should be bothered about and caring for?
So, a couple of things, right? You had mentioned the teeth, of course, which is what everyone thinks about when you look at the dentist. Then there are the gums. Okay, the gums are what surrounds the teeth, and it forms the sort of the cushion for the tooth, and the tooth itself is invested in the bone. Okay. Besides this, the other oral musculature, the cheek, the tongues, the soft tissue, all of them play a very important part. But starting from where I said first, the gums. A lot of people think that, they have to separately massage the gums or separately do something like oil pulling for the health of the gums. This is not necessarily true. As long as the brushing technique is done correctly, the gums are going to get stimulated. This is not a problem. Next comes to the tongue. A lot of people have questions. Do I clean my tongue to begin with? Okay. So tongue cleaning is recommended, especially if there is a perception of bad breath. So bad breath usually starts from the gut. Okay, it is stomach acids which is causing the bad breath. It's very rare that someone has a cavity large enough which has become a cave to like trap food, and that food is sitting there for so many days that it starts to smell. Usually bad breath comes from the stomach. But the tongue is one area where if there is a coating on the tongue which is not being cleaned thoroughly, then in that case that can also lead to bad breath. So tongue cleaning is essential. So now with the teeth, with the correct toothbrushing technique, we are able to clean the gums. With the tongue cleaning, we are able to, usually a copper tongue cleaner is perfectly fine. You shouldn't be too aggressive also, you shouldn't damage the tongue. But those are the things to watch out for when keeping things clean. Then you asked another component, very important and easily forgotten, saliva. Saliva, normal saliva flow is very, very important for prevention of cavities. And this actually comes to the explanation of why night brushing is important. Everyone brushes in the day to keep their friends, but they have to brush at night to keep their teeth. Okay? That's because the saliva shuts down at night. There is no saliva production. We've just had dinner and all of that food still remains in the mouth. And what happens is the dry mouth environment for the bacteria is perfect for producing acids, and the acids make hole in the teeth. Okay, so if someone wants to avoid long, expensive dental appointments, I would say night brushing. Again, this is a thing in India we are not so good at doing, and the Western population seems to have understood much better. Maybe we as dentists also have failed in properly educating, but we try our best to tell everyone that twice a day brushing is key. So coming back to the saliva itself can be reduced if there is certain medications will reduce saliva. Your common medications which are prescribed sometimes for BP, sometimes for like a diuretic. All of these things will reduce saliva. That is something to be concerned. Inadequate water intake is another problem which we see. At least 2.5 to 3 liters a day should maintain normal salivary flow. Then there are other extreme conditions, like let's say someone's had radiation therapy to the head and neck region. The salivary glands might have been affected, and therefore they will see xerostomia. We see rampant caries in these patients.
So again, it's not only your tooth. There are so many other things one should
Exactly.
care about inside our mouths. And we'll get to it about how to brush and everything, because I think that's that is something basic which people do not know and should
Absolutely.
know.
Absolutely.
Beyond looking at the mouth through just the lens of looks and the smile and the alignment and everything, what can a person's mouth actually tell you about them regarding their life as such?
So actually, the mouth is a very good indicator of what's happening, and very often we are the ones who tell diabetics that they are diabetic. Okay, there is a certain smell. Okay, it's kind of I don't know if it's even documented, but we dentists know.
Seriously, smell வச்சே வந்துட்டு diabetes இருக்குன்னு கூட you can detect, and that is something
I
I
can pick it
never
up.
heard. Okay.
Certain people. Okay, so as I was saying, dentists can pick up diabetes very easily because the gingival health, the gum health, is usually looks puffy, and they usually bleed. Okay, so even with simple gentle brushing, it bleeds. Okay, so that's the complaint that patients come in with. Doc, when I brush my teeth, it bleeds. Okay, so the first thing we do is we get an HbA1c. We want to see what is their 3-month sugar control. Then it may be because of local factors also that's happening. They've just not brushed well enough, and there is a lot of food accumulation between the teeth that is causing an inflammation. But typically, diabetes is the one to blame. Secondarily, vitamin D is also something we look at. After COVID, we saw a lot of deficiency of vitamin D because people stopped going out, and that realized in a lot of problems inside the mouth, including failure of dental implants. Dental implants are placed in the bone. If you have vitamin D deficiency and bone metabolism is affected, your dental implants are going to get affected. So that is now coming up a lot in our evidence as well. But yeah, we are able to see a lot of issues in the mouth. And as coming closer to your field, we would see something like a pyogenic granuloma in the gums, which is a little boil. It's a little harmless, benign swelling. But because of the various hormone regulations that happen during pregnancy, it's quite common for a pregnant mother to have this. Generally, they tend to panic because it looks
Scary,
quite
yeah.
scary, but it's self-resolving. It limits itself. The only advice is to keep it clean, keep the teeth clean, floss, brush, all of those things to maintain hygiene, and that will resolve on its own.
I'm sure most people do not brush twice a day, let alone floss. And as I said, when we talk about oral care, அதை பற்றி இன்னும் பேசலான்ட்டுன்னு. And I think as adults வந்துட்டு whatever we do is what we are going to pass on to our children. So when you're doing something specific or a routine, நீங்கள் follow பண்ணிங்கன்னா தான் we'll be passing it on to our children. So again, it is very important that the adults take care of this and start practicing good oral hygiene so that they can pass on those same good habits to their children.
So
which
when
is
I
very
see
important.
kids in the practice, I tell them brush twice a day, and I tell them all of this, and then I look straight at the parents and I say this applies to the entire family. I say it very threateningly.
Yeah, I know. Because I know, I mean, even speaking for myself, I mean to brush twice a day. Now I have said, I was just telling my assistant doc yesterday when we were discussing this, I said, in Mela, I'm going to keep that analogy. Just like sink la vandittu, if I put the used dishes night vanda, I will not be like, I cannot leave it there. எனக்கு அதை க்ளீன் பண்ணிட்டு தான் I have to go up to bed ன்னு இருக்கும். அப்போ why am I doing the same thing to my mouth? I should not do that. So if I keep that analogy, I think I'll be more proactive about it. So yes, because if you have said that morning brushing is for your friends and night brushing
For
is
your teeth.
for your teeth. So it is that important, and that should be drilled into our heads, I guess.
One suggestion is you have all these apps which remind you of these things. No, so the app is, it can tell you to drink water.
Yeah.
It can remind you to brush your teeth. All of those things that can be set up. So
Yeah.
I think it's definitely
All of us are with our phones, so keep
Yeah.
reminders for what is important. True.
Yeah.
As a family, go and brush. So it's your nighttime bedtime ritual, I would guess. So
Yeah.
that's something we should all start doing. So what is this oral microbiome? Naraya gut microbiome pati. There's a lot of talk nowadays that it is governing like so many things across our whole body and not just the gut. And madri, what is the oral microbiome? Is it separate from the others, and why is it important?
So extremely important. So if there is a poor oral microbiome indicating usually gum disease, so periodontitis. So when you have initial gum disease, it's called gingivitis. As it progresses to bone loss, we call it periodontitis. But these patients usually have a disrupted oral flora. Okay, so the microbiome is not healthy, and we see the connected things. So usually we will suspect diabetes. Okay, there is a cross link. There's an interlink between diabetes and and a poor oral microbiome. Also, there is risk of cardiovascular diseases. This has been well documented in the literature. People with gum disease, periodontitis, are at risk for cardiovascular diseases, heart attacks, strokes, all of these things. And also, it has been linked to other things such as Alzheimer's. Okay, there has been papers which are published where people with gum disease have a higher incidence of Alzheimer's, and also we have issues where there is a respiratory challenges, but those are like little less on the totem pole of sort of importance. It's usually cardiovascular disease, and related to your field, your preterm birth weight, the low birth weight, and premature deliveries, all of those things are related to poor oral microbiome. So extremely important, which is why again we stress on maintaining that oral health to reduce or sort of nullify the effects of a bad microbiome on the systemic health.
So I think that bad microbiome, so the the bacteria it produces a chronic low-grade inflammation
Basically.
throughout the body internal. And now we are talking about the oral microbiome, the gut microbiome, the vaginal microbiome. So I think more than humans, we are made up of we are I think
We are
more
more
bacteria.
bacteria,
So
absolutely.
again, they govern against so much of our health, and it is important to nurture the good guys and not let the bad guys really take over.
Absolutely.
So you have already said there is a link between systemic diseases like Alzheimer's, maybe, and then diabetes and even heart attacks. Who would have thought that anything connected to your gum infection or inflammation can really be related to something as serious as heart disease? Now, if people knew that there was such a link, maybe they would start taking care of their oral health a lot better, because everyone's bothered about heart attacks and everything. But even small things like this, and once that oral hygiene improves, I read somewhere that there is actually a significant improvement in the HbA1c also.
Right. So also, if you look at it, if someone is taking the effort to care for themselves and improve their oral hygiene, they are not just doing only that one thing to make themselves better, right? They are probably also improving their diet. They're probably also looking at exercise. They're doing a whole lifestyle shift now. So all of those work together positively. So that's something which we have to keep in mind.
Sure. So taking care of our teeth, which is something very basic, are we actually doing it the right way is what I wanted to ask you. So I have a model here, so you
Sure.
can ask it. You can first tell us how we should be brushing, because again, I don't think many of us are really clear on that.
Yeah.
So how do we actually brush?
So before I demonstrate on the model, what I want to say is be aware of the fact that you should not hurt your gums. Okay. How were you taught in school? They probably said your teacher stood in front of the class and take the brush and do this. This is the normal thing what they would demonstrate, and this is very injurious. So because what happens is when you do that motion, you are ending up abrading the gums. Okay. So as you abrade the gums, you're going to cause something called gum recession. More of the root of the tooth is going to get exposed because the gums are running away from that abrasive action. So over time, we especially see it in right-handed people, we see it on the left side because they go like this. It's very easy for them to be aggressive. Left-handed people, we see it on the opposite side. Okay. So keep that as the fundamental concept. Don't injure the gums, but you need to clean everything. Okay. So how does this work? So for the upper, what we would do is we would start with the edge of the bristles at the gum line and sweep downward like this. Okay. Never like this. Okay. Sweep downward like this. For the front teeth, we hold vertical. Okay. And then for the other side, we also go in the same way. Okay. For the inside, it's the same. We start at the gums, just the edge of the bristles, The other thing what people might do hearing this advice, they may put the entire brush on the gums and go, this will ulcerate. We can't do this either. So only the edge, start at the gum line and sweep down, go vertical for the front teeth and over here. Same way for the lower, for the front teeth, the back of the front teeth, we hold vertical. We sweep from gums going up over here, sweep from gums going up over here, sweep in the other direction over here. The easy trick, and at least what I do, is I hold my teeth edge to edge, okay? Edge to edge. This model doesn't really allow me, but basically bring the front teeth together, edge to edge, and go in with the brush and go in a circle. Going in a circle is the same as what we just spoke about, okay? And even in the front, we can go in a circle. Here also, we can go in a circle. One area where people miss is the back of the upper teeth, okay? So these areas, what happens is, we think that the brush has to go in, so now I have to open wide. When you open wide, there is a muscle that comes over here which blocks the entry of the brush. So to brush these areas, you have to actually put the brush in, close the mouth, and then is only when you will be able to get this area. Otherwise, it's impossible to reach. With the open mouth, this will stop around here. The brush can't go in. Yeah, so we get a lot of cavities and problems in those last teeth because the brush, even though they're very diligent, they've used a big-headed brush. We would want this. This I would say maybe 10% smaller than this in terms of length would be the ideal size of brush. Yeah, so this is for everyone. It should be fine. For kids, of course, there are smaller brushes, but for adults, about 10% less than this. The width is okay.
Okay. So it's not like this. So again, you demonstrated the proper technique, and if you're not doing that, at least it's in circular motions here.
Circular motion or that individual motion, both are fine.
Both are fine.
Both will work fine. Just this to and fro motion. Sorry, I should bring that up. The to and fro motion, what we are taught at school, is actually okay only for the biting surface of the teeth because there are no gums to injure. So biting surfaces of the back teeth, we can do to and fro. There is no issue. Will not injure anything.
That's good. So how many times?
Twice a day, of course.
Twice a day.
There are some people who are over
after
into
each meal or something like
There
that.
are some over into people who like to do 2 times, 3 times, 4 times. 3 and 4 is too much. Let's stop at 2 times.
Twice is
and
more
that's
than
it.
enough.
Yeah.
Okay.
There, you may be a certain category of patient who, let's say, post-radiation. Okay, post-radiation for cancer treatment, they have a very dry mouth. Those patients I put on a very high fluoride regimen. I make them brush 3 times a day because they are at very high risk for cavities. Okay, so for them, there are exceptions. The normal everyday patient, twice a day, please, is more than enough.
Before or after coffee? Because many people do have bed coffee, I'm sure, without even brushing their teeth. So do you think there are some bad bacteria there overnight, which is you're going to swallow it, or is there any harm in doing that?
So the general recommendation is brush first. As soon as you wake up, brush first so that you clear the bacteria in the mouth which may have accumulated overnight before you have your coffee. Okay. Yeah, but I can understand why people are doing this also, because they don't want the taste of the coffee to be overpowered by the minty flavor of the toothpaste. So maybe leave a 10-minute gap, So that anyway, it's also recommended, you wake up, you brush, you have some water, wait about 10 minutes and then have your coffee. That's probably a good thing to do.
Good thing. And actually, காலையில எந்திரிச்சோன coffee குடிக்காம இருக்கிறது is a good habit. But again, I don't think most people would agree with that. Or even if they agreed with it, they would be able to do it, I mean.
Yeah.
This was a curious thing I came across, that spitting out the toothpaste and rinsing, which is what 99% of people would actually do, versus leaving it in. So actually, do you leave the toothpaste, the feel of it there without rinsing it out? Because what I read was, do you put sunscreen and then wash your face and take it all out? It's just like that. It is better that you would leave it in. But how is that done even?
So for your standard, this is my sort of take on all of this. For your standard everyday fluoride toothpaste, okay? And you're a regular patient, you don't have rampant caries, there is no major issues in the mouth. For those patients, I would say brush, and brushing takes about, let's say, 90 seconds to 2 minutes. Okay, brush all the teeth, spit it out, rinse your mouth, and go about
So
your
we are
day.
supposed to brush for 90 seconds to 2 minutes.
Typically, that's the amount of time.
Yeah, I think everyone brushes for less than that, much less than that. I'm sure. Okay.
And there are people who brush 3 times
2
that
minutes.
also. Yeah,
Okay, okay.
like they watch their show while brushing, which is
Okay.
like I don't know how they
You
do it,
keep
but they
on
do.
doing it.
Yeah, but then they end up braiding their teeth too much. So my take on this, how I deal with this, because different sources will give you different information. For the regular everyday patient, brush your teeth, spit the excess, rinse your mouth, go about your day, have fun. Okay. But there is a certain category of patients where, let's say, they have a lot of erosion of their teeth, lot of abrasion, not of attrition. Attrition means physical wear and tear of their teeth, okay, or acid-related damage. For these people, we prescribe them a prescription strength toothpaste, okay, which helps in remineralization of their teeth. For these patients, very specifically, the instructions are used only a pea-sized amount, brush all your teeth, spit the excess, but for 15 minutes, no drinking water, no rinsing your mouth to maximize the effectiveness of that toothpaste. Okay. Various toothpaste brands have different approaches to this. Some of them say brush and leave it on and wait for 15 minutes. Some of them just say rinse your mouth. There is no hard evidence one way or the other. But for whenever I give a prescription strength toothpaste which is not available over the counter, those patients I have this instruction for the 15 minutes.
So otherwise, for normal people, it is okay to spit it out and rinse it out also. So toothpaste, dentist recommendation. Are there certain things which you would look at when you select or you prescribe or suggest, recommend?
So the only thing I look for is, does it have fluoride? Okay, fluoride is one of the most well studied ingredients which have been added to toothpaste. You will always find sort of fluoride naysayers, okay, because they have misunderstood what is happening with the evidence. Okay, they will cite saying that, oh, they used to fluoridate water in that community and now they don't do anymore. So there are two different things we're talking about. One is fluoride as an ingredient in toothpaste and mouthwashes, and fluoride as artificially added to the water supply. Okay. So when you artificially add fluoride to the water supply, if it is within that control limit, which any government will ensure that it's in control limits, it has been shown that the population of children in that area have lesser cavities. Okay, because the fluoride is really helping. Now, lot of countries stopped doing it, especially in Europe, because they felt like the amount of effort required to go through this is difficult, and plus you're removing that aspect of choice from the population because it's in the water. They can't say I'm not going to have the water. So what these countries decided was, most of the European countries, I think it is only the Republic of Ireland that still does water fluoridation. Most of them said, look, fluoride is there in toothpaste anyway. Okay, and we're telling everyone to brush twice a teeth. Let's say there's someone who says that they don't want fluoride for whatever reason, then they're free to buy the non-fluoridated toothpaste, and that's fine for them. Okay,
Choice. Okay.
it's their choice. Let them deal with it. So I would say the main thing is fluoride. I am not interested in the other additions. Okay. If there are other additions, I want it to survive in the market for 5 years before I prescribe it to a patient. Very famously, Colgate Total, which was a well prescribed, it's still popular, it's still there in the market, used to have something called triclosan. Triclosan was found to have harmful effects. They didn't really change the brand name, it still remained Colgate Total, but triclosan was quietly removed. We've had toothpaste which have those plastic microbeads. That is also so harmful to the environment because it's just adding to plastic pollution to the environment and in your body, because some amount might get ingested also.
And what are you
Yeah.
actually getting out of it? Nothing.
Supposed
Just
to
that
be
it
a
looks
scrubbing
very,
action.
Okay.
Okay, supposed to be a scrubbing action.
Microbeads.
Some, companies are just going to look at their products and say, how do we differentiate? Some people will say, let's add salt. The next person is going to say, let's add charcoal. It's whatever you want to add, they want to add, and then we are subjected to it. I kind of feel like we are the guinea pigs when it comes to these toothpaste. So I am very particular in my recommendations. New brands, I don't want it. We get a lot of messages, oh, we've just started this new brand, it's fantastic, let's collab, let's work together, let's do this. I'm like, how long have you been in the market? We just launched 5 months ago. I'm like, see you in 5 years.
Yeah.
And these brands don't exist in 5
Yeah.
years. They're all
Is it?
gone.
Okay.
They're all gone.
Wow.
They don't survive.
Because you were talking about this, I saw. I went to my daughter's closet, and right now she's studying in London. But I knew that she got these two toothpaste very excitedly online from a company called as Salt. It had a night toothpaste and a day toothpaste. And I went onto the site and there were like very
Glowing
fancy
reviews.
sounding toothpastes like matcha and then cinnamon and stuff like that, which is going to attract young people, right?
Yeah. Gen Z
They
marketing.
had a small key there, very cute little key given there, which they could use to roll out the toothpaste. Like we keep on doing that, right? They had that device which had that. They had 24 karat limited edition gold mouthwashes. Okay, I was like zapped. I said, "That's really cool. It sounds very cool, but I don't know whether it is that
Marketing.
effective."
Yes. So it's all in the marketing. And I automatically don't trust companies which heavily push non-fluoridated toothpaste, but saying that, oh, no fluoride, no harmful effects, all that stuff. But quietly on the side, on their website, you will find a fluoridated toothpaste. So I'm like, which side of
Side
the
are
line
you?
are you on? Are you fluoride? You should have a belief, right?
Yeah.
You should be either here or there. You can't sell both, but that's what they do. Okay, so these companies, I just immediately, all their products are like banned from me as
Okay,
soon as
so
they
I
start
don't know
talking like
whether
that.
this has fluoride or not, but I was thinking
This
that it was
particular one is only a marketing thing. So they have
okay.
spent heavily on the marketing. I don't know the company personally, so I really shouldn't comment. But for me, that product, that toothpaste, should have been on the market for 5 years. Otherwise, I'm not prescribing it.
That's your rule.
That's my rule.
Yes.
Yeah. I'm very old fashioned.
No, it's better to be safe than sorry for
Yeah.
sure. And as you said, because we are being subject to it as guinea pigs, that doesn't mean that we should be doing the same to our patients when we are
Of
giving the
course.
recommendation.
Yeah.
So it's very, it's actually quite ethical to do that. So tooth tablets, again, what is your take on that? Because again, the packaging, the toothpaste comes in, so it's easier to carry when you travel, and then just you chew on it and spit it out. I did try a couple of them because I did want to cut down on buying those tubes. I was doing what I could, but I didn't like the taste. I couldn't really persist with it.
See, effectiveness is a question. And this now also comes down to the mouthwash question. Are mouthwashes and tooth tablets effective and are they a substitute for toothbrushing with toothpaste? No. Okay. Simple reason is if you're chewing onto a tooth tablet, how can you guarantee that tablet has reached all corners of the mouth and brushed away whatever deposits are there on the teeth, or scraped away all the deposits on the teeth? How can the tablet really do that? Yes, you are exposing it to a dentifrice, which is what is going to clean your teeth. But has it done the job? Not really. Same way with mouthwash. You can put all of the antibacterial, fluoride, whatever into mouthwash, but it's very transient. You're taking it in the mouth, you're swishing for about 10 seconds, you're spitting it out. There is no long lasting effect. Mouthwash also, the problem is some of them have alcohol. Okay, I won't name brands, but there are very famous brands which everyone knows which have alcohol. And what happens when you have alcohol, when you swish with that mouthwash, there is immediate bacterial kill. Okay, mouth is going to be devoid of bacteria. Congratulations. For all of 1 minute. Okay, then you're breathing, saliva production is happening, all of the bacteria are going to come right back. And in fact, the problem is there is more bacteria because now you have a dry mouth. Okay, so the dry mouth creates a sort of environment which is ideal for the bad bacteria. So this is why alcohol-based mouthwashes we don't
Because they
recommend.
will kill both the good and the
They
bad
kill
ones,
everything.
right?
Yeah, they kill
Which
everything.
is not really what we want.
Mouthwashes we only prescribe as, oh, do you want like a feel good sort of feeling, or you're about to go out, you want mouth to feel fresh, but it is not a substitute. Even these tablets are not a substitute for
Normal
normal
toothpaste.
old-fashioned toothbrush and toothpaste.
Toothbrushes, which one? You said that the length should be a little lesser, probably
about an
compared
inch,
to this,
yeah.
about an inch. So soft, medium, hard.
Soft and medium for most people. We don't recommend hard. Okay, I've never had to recommend hard for anyone. Soft, ultra soft, soft, and medium is like a rare recommendation. Okay, because medium is actually quite hard itself. Can be too abrasive. Remember, it's not only the toothbrush. It's toothbrush in the presence of toothpaste, and toothpaste is the thing which is like sandpaper. So if you're going now with a very hard instrument and you're using that toothpaste, that is going to really wear out the teeth.
So how often should we change? Because I think we keep using it forever. I mean, I think we spend a lot on other things, but the Indian mentality was still the toothbrush really,
Till it falls
really,
apart.
yeah, it falls apart. Please keep using it
Once in 3 months.
once in 3 months.
Once in 3 months. Or if you notice that the bristles are splaying out. Okay. So if the bristles were like this when you bought it, but now they're like this, it's time to get it.
Soft are then I think even 3 months last Huma, it will splay out
Maybe
quite
ultra soft
fast,
will go even
right?
sooner. Yeah, depending on technique. So 3 months is the maximum. But அதுக்கு முன்னாடியே அது மாதிரி இப்படி ஆயிடுச்சுன்னா then
You
we
have to
yeah.
take normal or battery operated.
So actually there are studies and அது என்ன conclude பண்ணியிருக்காங்கன்னா suppose the battery operated is giving you better motivation to do your oral hygiene, get the battery operated. That's all. There is no major difference between both. But நிறைய பேர் battery operated first try பண்ணும்போது they do feel that their mouth is cleaner. Because there is a sort of ultrasonic motion of these newer toothbrushes which are ultrasonic, and it is a very effective clean, and I have felt that difference myself compared to the manual toothbrush. So I mean toothbrush is a boring thing, koncham excitement kondu varalaamla, so let's get some battery operated
Yeah.
thing over there, and you can enjoy that very very sort of sparkly clean feeling. Yeah.
So again, the feel. So go for whatever you feel like, whichever gives you the better feel.
Yeah, but follow those recommendations, like not a very big head, what we spoke about, soft bristles, all of those things have to be kept.
Still have to be kept in mind. Flossing.
Flossing is a very very good thing because நம்ம ப்ரஷ் பண்ணும்போது பல்லுக்கு நடுவில் க்ளீன் பண்ண முடியாது.
Yes.
We can only clean the outer and the inner surfaces. Okay, we can clean the biting surfaces. ஆனால் பல்லுக்கு நடுவில் க்ளீன் பண்ண முடியாது. So that is where flossing comes in. It's the use of a thread which goes in between the teeth. Now and we go into the gap and we pull it against the teeth. It's not only going into the gap, it is going in the gap, adapting to one surface of the tooth, pulling it out, going in the same gap, adapting to the other surface and pulling it out. So that is a sweeping motion of the floss which takes it out. Now நிறைய பேருக்கு இது ரொம்ப கஷ்டமா இருக்கும் பண்ணறதுக்கு, because one thing is when they do it they see blood, because for a long time they have not done this or they've never done it and the gums are inflamed. So when they do it the first few days they see blood, then they get scared. They'll say doc நான் பண்ண வீட்ல ஆனா ரொம்ப ரத்தம்
So
வந்துச்சு,
they
எனக்கு
think that
பயமா
they are
இருக்கு.
injuring. நம்ம தான் ஏதோ
Think they are
பண்றோம்.
injuring. They think they are injuring, but they are not. They are removing the inflammation. They are removing the food particles. As the gums are inflamed, it is reacting to it. Usually, if they are very diligent, they do it for about 4-5 days, there will be no more bleeding.
So do you recommend flossing every day then?
We recommend flossing every day. For people who can't, we use a water floss. Okay. So water floss is a very nice thing to get
Yeah,
in between
same
the
company.
teeth.
My daughter's got that water flosser. I
I'm
saw
sure.
that yesterday. Yeah.
Sure, the marketing has been very effective for your daughter.
Yes, it has.
Yeah, so the water floss is a good thing, especially for people who are a little more aggressive, where they are very good about flossing, but they say I floss and always food gets stuck, and then I floss and then it slips and then I bleed and then it injures and this and that. We just put them on a water floss to flush out whatever food particles. Of course, it is indicated that there is some other condition in the mouth which is keeping the gap open, which requires probably a filling or some kind of restoration. But at least till they can get that done, they use the water floss so that they are not bleeding when they clean things.
So I think that would work better for me too, because somehow I have this maybe hesitancy about flossing, because for the exact same reasons which you said, because again I don't think it takes time, it has a learning curve,
It has
I
a
guess.
learning curve, yeah.
And then you see blood and you think that you're doing it wrong and things like that, but a water flosser it would be a little easier compared to the normal
It's a little
flossing.
easier. The evidence on effectiveness between water flosser and regular floss is, I would say, a little mixed. I've read the papers, and they conclude saying that water flosser is as good as or better than floss. The problem is the papers are sponsored by the water floss
companies.
So there is
Then,
heavy bias. So when there is heavy bias, at least the ones I've read, when there's heavy bias, I'm like, I don't know how much to trust,
Another thing which is like very popular, or it's an ancient practice in our country, our side of the world especially, is oil pulling, right? But for it to be effective, how long are you supposed to be swilling the oil around for?
So I don't recommend oil pulling. Okay, evidence doesn't recommend oil pulling. There have been some limited studies poor sample size, so very less number of population. The problem with oil pulling is one, compliance. We are asking them to swish oil between the teeth for 15 minutes. Asking someone to brush for 2 minutes is hard
Yes.
enough. Asking them
True.
to floss for about a minute is hard enough.
Yes,
Getting
yes.
compliance of 15 minutes of swishing oil between your teeth, and then what you're spitting out is this disgusting
Yeah,
oil,
yeah.
is not very, very practical. Okay. Secondly, they may aspirate the oil, because when you're keeping it in your mouth for so long, you may end up aspirating and end up with an oil emphysema. So these are the reasons why we
When it
just
is not proven to have that much benefits, and as
correct.
you said, do the basics first, and
Yeah,
then that is hard enough. So I don't think most people would be willing to do that in a busy morning for 15 minutes
15
every
minutes.
day.
Yeah, yeah.
Tongue scraping, you said yes. Probably how often a week?
Usually once at night should be enough.
Once.
Once at night should be enough.
And especially when you have a thick buildup of residue or
Correct. Yeah.
white
If you see
coating,
residue, white
yeah,
coating, then even in the
then
morning you
probably
can
it
do
is
it
better
once.
to do that. Mouthwash, we have already covered. You said if you like the feel, go for it, but avoid alcohol-based mouthwashes.
Correct.
Night paste and day paste, no difference. I guess you can use
I
one
have to
paste.
go into the marketing material and see if there's a real difference
Okay. So,
besides the box.
okay. I think the flavors are different and it had some other different ingredients. So you would probably have to check it out to
I'll have to
comment
check it
on
out.
that.
I don't know this. Always toothpaste manufacturers are figuring out how to keep things exciting, you know.
How much of toothpaste on the brush? The whole you go along.
If you look at the ads, they will empty half a tube
Yeah.
onto the brush,
Yeah.
but you don't need that much. It's usually most toothpaste, a pea-sized amount is more than enough.
So your ideal dental care routine
Mm-hmm.
as a dentist, what would it be?
So 6-month dental checkups, brush in the morning, brush at night, tongue scrape at night, and then water floss or regular floss at night. That's it. It's just a 4-step plan.
So that's what you follow too.
Yeah, exactly.
Nothing fancy.
Yeah.
And I came across this. Even my assistant said that her son was telling her or educating her after seeing on social media that there is apparently all these color marks on toothpaste tubes which indicate whether they contain natural ingredients, a mix of natural and medical, or purely chemical. So he was telling that we should avoid the black dot ones because probably they are purely chemical. Is there any truth behind this?
No, so those black dots are just manufacturing indicators for when the machine has to cut the box, you know.
Yeah.
But it has nothing to do with any type of indication of what is in it. You may see toothpaste with a green symbol indicating vegetarian, but besides that, there's not much more to it.
So if you want to know the ingredients, you have to go and look them up yourself, which
Read the
is
box,
on the
yeah.
box, but don't go by the marks.
Not
It's
by the
not
color,
true.
no. Social media has given a lot of time to everyone.
Yes, and especially things like this, which seem really different, they seem to blow up and go viral, though they may
Absolutely.
not actually be true.
Yeah.
So brushing immediately, someone has had a sugary treat, a donut, say, or a muffin, and do you recommend that they should immediately, so they were like worried, do they go and brush immediately versus actually after some time?
No, enjoy the birthday party, go home, and just at dinner time have,
Yeah.
brush your teeth. Very important thing now to continue on this is if you have something acidic like orange juice, you absolutely should not brush immediately because now you have acid in the mouth and you're taking a brush and you're taking toothpaste, and in the presence of acid, we are abrading away the teeth. You can cause a lot of damage. Okay, so orange juice, lime juice, all of these things which are acidic is something which we wait for a buffer period of about 20 minutes at least, or we drink water and then brush the teeth.
So
Yeah.
not immediately. That is
Not
a very
immediately.
important
Yeah.
message. There is this age-old Indian practice, right? We eat with our hands, and then after each meal, especially in the previous generation, if you see that they would go and rinse their mouths out. So is that actually a good practice, and does it improve our dental care?
It is a good practice. So I think whether Western or Indian or whatever type of food you're eating, and whether you're eating with a fork, chopsticks, or your hand, rinsing out your mouth is going to be helpful to reduce the microbial load in the mouth for sure. There is going to be some leftover, of course, but rinsing it out is going to really help with clearance. So it is definitely recommended.
So yes, so again you can practice that, and that is one of the simplest ways you're getting out the food residue at the least, I would say.
Yeah, there is another trick which I think nobody talks about. Let's say you've had almonds, cashew, something like this, and now you have that feel in the mouth that all of that is stuck in between the teeth and it's quite annoying. The fastest way to get rid of it, especially let's say you're in the middle of a work day and you've been told by your dietitian that you should have some nuts because it's healthy fats. So you're having it and now you're like stuck with this mouth which is like all, feels like there's a lot of little particles everywhere. Sugar-free chewing gum. Just chew on that for about 10, not even 10, 5 minutes. It's going to mop up everything. It'll just take care of all those little nooks and crannies where where there's nuts would have got stuck, and you'll have a clean
Because of
mouth.
the saliva circulating?
Because it's sticky. It's
Sticky,
just going to
okay.
it's just going to
Goes
hold
there
on
and-
to it, and it's just going to pull it out. So this is a little secret.
Yeah, okay, that's a cool hack, I would
Yeah.
say. So go for stock some sugar-free
Sugar-free
chewing gum and go
yes.
for it.
With sugar-free chewing gum, also people get kind of obsessed with it. They will have a pack a day, like they keep chewing. These lead to TMJ issues. So their joint starts to hurt because actually it's not really the joint. Most likely it's muscle fatigue, but they start saying they have pain over here because all day long we've been designed as humans. Our chewing cycle, there are studies to show this, but the amount of time in 24 hours which we should spend chewing where the teeth are in contact is only about 12 and a half minutes.
Oh, wow, for
In-
24 hours.
So that includes the time when you're talking and your teeth touch. That includes when you're swallowing when your teeth touch. That includes when you're chewing and your teeth touch. It's only 12 and a half minutes. Now you can imagine someone having a pack of chewing gum throughout the day, how much overuse is happening. So everything in moderation. Basically.
Moderations, yeah, don't go crazy on it.
Exactly.
So, bleeding gums. If we bleed from any other part of the body, we are immediately going to be worried, of course. It's from
Right.
the eyes, from the ears, from the nose, whatever. But when we bleed from our gums, we somehow think, okay, vitamin C deficiency. Yes, irukla. But most often, paravalla, this is normal. I brush too hard. We just tend to disregard it. Is it as innocuous as it is made out to be, or we should visit a dentist?
The reason why people are not so serious about it is when your gums bleed, they don't hurt. There is no pain. Even when you brush and there's bleeding, there is no associated pain. Associated pain is the trigger that brings a patient to the dentist. And in fact, sometimes my patients who come in and they have a large defect in the tooth, but they say they have no pain. This is why the defect is large. Okay, so if they had pain, they would have reported much earlier, much easier to deal with. Okay, so even with the gum bleeding, that is really the challenge why people don't show up. But if it happens often enough, people generally show up, because it's not normal to have an organ essentially bleeding continuously every time. One off thing they may ignore, but if it happens many times, they do
It
end
is
up showing
better.
up. Yeah.
And what would be the cause, common cause?
So usually it is some debris which is accumulated. They're not cleaning between the teeth properly, or they're not they're not doing their normal brushing properly. There's probably lack of flossing. It could be nutritional, like as you said, vitamin C deficiency is a big thing. But as I had mentioned earlier, one of the most common is there is some diabetes beginning or already well established, which has compromised the
Some
health of the gums.
inflammation happening.
Then there's a whole slew of pathology conditions
Okay.
which are rare, okay, but there are a whole lot of other possibilities.
Yeah.
You can have very inflamed gums from someone who's taking, for example, anti-epileptic medications. Very commonly we see this. So, these are sort of out there type of things. So I think it's beyond the scope of this discussion.
Definitely. We will not confuse them. So probably if it is happening, adikadi ahardana, it is better to go and visit the dentist
yeah.
once.
And usually it is a simple fix. Yeah, usually it is a simple professional cleaning at the dentist and then proper instruction on brushing technique, and the problem is solved. Most likely it will be that.
So impact of oral health in something which is very close to my heart, which is women's health. So PCOS, insulin resistance, irukra patients, do you think they are more prone to cavities and the impact of that?
Yes, very much. It's been well documented also because there are hormonal changes. There are changes in the saliva consistency, texture, quality. All of these things impact the gum health, and also it has been shown that there are more cavities as well, which happen as a result of it. Yeah,
So I
definitely.
thought that was really interesting because PCOS, we talk about a lot of things, and we know that it is a metabolic syndrome, not a problem with the ovaries. Na? But specifically, connecting it to actually having an implication in oral health is something I came across when I was doing my research for this. So I found that really interesting. And oral health in pregnancy, because number urla we have already said that people do not visit the dentist, but pain vandichina, it's such a severe pain, we will
Yeah,
be
you
running
would be running,
immediately
yeah.
to the dentist. ஸோ அந்த மாதிரி ஒரு situationல in pregnancy, is it better that everyone at least has a dental visit once because we don't do the usual preventive dental checks?
Right. No, it's a fantastic question. If a couple is planning to get pregnant, then we recommend that they visit the dentist to make sure that, whatever challenges are there in the mouth have been cleared out even before the woman gets
Reconception,
pregnant.
okay.
Right. Now, if the person has a, let's say, cosmetic related issue and they want to get it done in the first, second, or third trimester, we won't do it. Okay. We won't do elective procedures. If they have come in with an emergency, severely painful teeth, something, and they have come in during their first trimester, we will only do pain relieving measures. Okay, we will use medicated dressings. We will do, if it has to be an emergency root canal, so be it. But we will get the tooth out of pain and defer any other restorative procedures till later. First trimester, we generally don't like to do much dentistry unless it is an absolute emergency. Because if they're in severe pain, that is also not good for the baby as well, right? And for their own health. Second trimester is the sweet spot. Okay, during this time, if anything is required, again, we won't do cosmetic, but if any procedure is required, like let's say the root canal treated tooth now needs a definitive restoration, we would probably end up doing it in the second trimester. Then the third trimester also we avoid, because now at this point the mother is generally very uncomfortable, can't sit in the chair for long periods of time, can't be in that same position. So generally we avoid third trimester as well. So this is how our protocol,
True.
these are the
Because
accepted
again,
protocols.
patients வந்து sometimes they are scared. எனக்கு பல் வலிக்குது, டென்டிஸ்ட் கிட்ட போகலாமா? டென்டிஸ்ட் கிட்ட போனேன், அவங்க இந்த மாதிரி கைன கிட்ட லெட்டர் எடுத்துகிட்டு வர சொன்னாங்க. If this is, I say, see, a pregnant lady is also a human being first and foremost. உனக்கு வலி இருந்தா 9 months நீ வலியிலே இருன்னு சொல்லிட்டு I'm not going to say. So again, it's risk versus benefit தான். And actually having something, some source of infection sitting there is actually going to predispose you to வந்து குறமாச பிரசவம், preterm labor or low birth weight and adverse outcomes like that. So please get it treated. Yes, you may require a few painkillers, some antibiotics, and that is absolutely okay. அதை யாருமே நம்ம வந்துட்டு தேவையில்லாமல் கொடுக்கக்கூடாது தவிர, no medicines should be given. There's no hard and fast rule.
Exactly, yeah.
And morning sickness, because so many patients they keep throwing up, and then thankfully most often first trimester it starts coming down, but there are patients who have been vomiting till the day they deliver, and நான் ஒரு ரூம்ல வச்சிருக்கேன்னு சொல்வேன் அவங்களுக்கு, because every week I needed to admit her till her delivery, all 36 weeks. So again வந்துட்டு அந்த மார்னிங் சிக்னஸ், ஆல் தட் ஆசிட் வாமிட் பண்ணிட்டே இருக்காங்க continuously, is that going to have a detrimental effect on their teeth?
Huge detrimental effect, because this is stomach acid which is coming out. So what happens is the teeth get eroded. Okay, so we spoke about attrition earlier. Attrition is tooth to tooth damage, like if someone grinds their teeth. Erosion is a chemically mediated, so the chemical is the stomach acid. So the stomach acid, once they vomit, the back of the teeth are usually affected more, because that is in the path of what they are throwing up. So the back of the teeth, we end up seeing very, very shiny, smooth surfaces. Then it leads to teeth sensitivity, all kinds of issues related to that. If this is a problem, of course, the healthcare team has to work to try and reduce that morning sickness. But if it happens, don't immediately go brush, because again, it is in the presence of acid. Because they will want to. They would have just, the mouth feels really bad, and now they feel like now is the perfect time to brush so that I can feel fresh again. Instead, rinse and wait a little bit and brush. That'd be the way to do it.
So rinse first and then wait a little bit and brush. That's good. Menopause and oral health, because is there a higher rate of tooth loss and then gums receding, bone weakness? Adalamme vandittu, do you come across that in your practice?
We haven't seen a very strong link between menopause. Of course, hormonal changes can have a huge effect overall, but we haven't seen a dental related connection to menopause at least when we observe in daily practice.
So again, if you're taking care of your teeth well, it's not as if after menopause they're all going to start
Not,
falling out or anything.
not really,
As
no.
with age, yes, there may be an impact, not specifically probably with
Yeah, there is
menopause.
age-related bone loss around teeth. There's age-related bone loss around implants. As time goes on, there is going to be those changes. But specifically related to menopause, we have not seen.
And I think there's something called as burning mouth syndrome, which is what is associated with menopause, but that does not specifically have it. I think it's a signal from the brain rather than anything to do with oral health, which is supposed to respond to hormone replacement in certain women. It gives them relief, but it may not be strictly related to oral health.
Yeah, burning mouth syndrome we even see in much younger patients and in much older patients. So it is like a multifactorial type of disease. So it is, but yes, there is. We have seen that in menopausal women as well that this could happen.
And preconception checks, I usually do advise that because again, it is better to check both the partners, optimize certain medications if they are on it for
Right.
various chronic diseases. Now, after unga இப்போ நீங்க சொன்னதை கேட்டுட்டு, I was thinking then dental visits should also be part of it, and because again, oral health is linked to fertility both in women as well as in men, and I even saw somewhere that there is a link between oral health and erectile dysfunction.
Yeah, and sperm counts as well, like low sperm counts. If there is poor oral health, there is shown an association now. We are not clear if it's causation. We are not sure that this because of this there is a low sperm count, but the conditions seem to be associated with each other. Someone with poor oral health might also have a lower sperm count. Yeah.
So yeah, so again across all from young to the old, I think we have covered how oral health is not linked to just your mouth but from head to foot. So yes, it is very important to care for it. So on that note, I think we can go ahead with a right or wrong myth
Sure.
or fact. Brushing hard means cleaner teeth.
That's wrong.
Okay. So don't go too strong on your teeth. அன்னைக்கு நாள்ல இருக்க கோவம் ஸ்ட்ரெஸ் எல்லாம் வந்து காமிக்கிறது not on your teeth,
Not on your
please.
teeth.
Yeah. If there is no pain, there is no dental problem. My teeth are fine.
Also wrong. 100% myth.
So as you have said that they can have really serious or big cavities without any pain, and that is the reason they have not approached the dentist அதுக்கு முன்னாடி. Scaling பண்ணும்போது they keep using the drill and that annoying sound comes, right, which is sensitive இருக்கும் சில பேருக்கு, but can it erode enamel and weaken your teeth actually?
No, not if done correctly.
Baking soda to whiten the teeth.
No, don't use it. There are better products.
Okay.
Yeah.
Only sugar causes cavities.
So when you think of sugar, you're talking about like refined sugar, but generally it is starch also. Like, so even if you have like say chapati, which you don't expect has sugar inside it, that would also cause cavity. It is like starch, carbohydrate buildup on the teeth is what will cause cavities. So I have to say.
Yeah, not only you're not eating na chocolate சாப்பிடலாம் in a cavity illa, it is also every food does have inherently sugar which is contained in it, and then again if you don't take care of your teeth properly, then again that could cause cavities.
Exactly, yes.
Banana peel, orange peel, lemon, apple cider vinegar to whiten teeth.
No, none of these, please.
No, again I think I have come across a reel somewhere on the banana peel and the எடுத்துட்டு and you do that on your teeth, and then that and the yellowing இருக்கும் சில பேருக்கு that helps அப்படின்ட்டு I think I came across. No, okay.
Stay away from reels, guys.
Okay. So bad breath means poor oral hygiene, poor brush பண்ணல நீங்க, அதனால தான் உங்களுக்கு வந்துட்டு your mouth is smelling.
No, also false, because as we spoke, the most common cause for bad breath is the stomach acids. Not so much
So
the
it's
mouth.
what's happening inside your gut and not necessarily inside your mouth.
Patients who report with bad breath, the first question we ask them is, do you have acidity? The answer is usually yes.
Clove oil or sometimes I have even tried this myself. பயங்கர ஒரு acute pain இருக்கு, you're not அந்த dental doctor கிட்ட போகிறதுக்கு முன்னாடி keeping a clove there, does it relieve the pain?
It does. So I would say, here we go. Okay. That's because it is an irritant. It is the same way how, let's say, if you have backache and you apply move, right? So that is an irritant. So there is the gate control theory of how pain is felt. So we are irritating certain fibers by applying that move or by placing that clove, which overpowers the sharp sensation of the toothache or the chronic backache.
Okay,
So
so
that's
it's
how it
not
works.
real, it's masking it
It's
and
masking
not
it.
really treating it as such.
The brain is not good at receiving both signals at the same time. It will preferentially prefer to hear burning, which is your move, or some kind of strong irritant like the clove. That is something which will overpower the pre-existing problem. It's not a cure.
Do it yourself toothpaste because toothpaste la chemicals. So அதனால வந்துட்டு turmeric, coconut oil, baking soda, raw and the rock salt எல்லாம் is natural and safer.
Please don't.
No.
Just there's a lot of research done for all these toothpastes. They've reached a point of safety which is very good. Anything you do DIY, there is a risk involved that you may be just following. There's a very high chance that you're following unsubstantiated sort of advice. So just don't do it.
Whitening strips bought online and put on your teeth for whitening, are they harmful or harmless?
The problem is I don't know which one to hold up for this because they are the challenge is the effectiveness. So if you have something which is very effective in whitening, it needs to be professionally applied. Otherwise, you will end up sort of causing severe sensitivity of the teeth and potentially burning the gums also because of the chemicals. So products which are available over the counter are going to have a very low concentration of the whitening agent so that people who are doing it themselves at home don't end up causing a problem to themselves by incorrect application. So if you want real benefit of whitening, it has to be done professionally. What you get in the store may do a little bit. The whitening toothpaste, I think, are hardly effective. But what you do at the store yourself with these strips and everything may be very, very mild effect, if at all. And that's the end of it.
Are mouth sprays effective for prevention of cavities?
No, absolutely not. It is just a momentary feeling. Even if you've ever used a mouth spray, you will probably feel fresh in the mouth till you reach your car. And then after that, that effect is gone. Yeah, so it doesn't do
So
anything as
it's
a
just
cavity
a
fighting.
feel good thing rather than
Exactly.
anything.
Yeah.
அந்த காலத்தில் இப்போல்லாம் டூத்பேஸ்ட்டே இல்லை சம்டைம்ஸ் விட்டால் வி சீம் டு பி கோயிங் பேக் பீப்புள் சே இது ஹார்ம் இருக்குது அது ஹார்ம் இருக்குது ஸோ அதனால் அந்த வேப்பங்குச்சி நீம் பார்க் வச்சு ப்ரஷ் பண்ணுறதெல்லாம் வாஸ் தட் ரியலி எஃபெக்டிவ் ஆர் அட்வைசபிள்?
It does have antibacterial properties, but the problem is ஒரு குச்சி வச்சுட்டு how are we going to clean
So much.
clean effectively? You can clean something what is accessible, but பின்னாடி எல்லாம் back of the teeth, how it's impossible to reach without poking yourself.
Yeah, so probably இப்போ இருக்கிற மாடர்ன் டேஸ்க்கு ஐ திங்க் வாட் இஸ் அப்ளிகபிள் இஸ் பெட்டர்.
Yeah, see, even that, the toothpaste companies will appeal to you. Suppose you feel, back in the day when I grew up, things were the best. If you're that type of person, that rose tinted glasses, so no,
Yeah,
we look
yeah.
at the past with that sort of thing. Toothpaste company is ready for you. Why? There is neem toothpaste now. That is also there.
Yeah. And then Ayurvedic toothpaste, are they better?
No, I would not. So here we go. My no recommendation for Ayurvedic toothpaste because they are not backed enough by long-term science. Okay, the studies are of poor quality. Mainly, my challenge with them is they don't have fluoride. Okay, they have a bunch of herbs. Okay, how effective it is questionable in the mouth. So I do not recommend Ayurvedic toothpaste.
So going on to the rapid fire next. Whitening toothpaste, fact or fad?
I would say more of a fad.
More of a fad. Salt in the toothpaste, does it do any good?
Very questionable. Not really required, I would say.
Charcoal toothpaste, what action do they really have? So is it again a fact or fad?
I would say this is a fad as well. And in fact, I would say stay away from charcoal toothpaste. There is some evidence out there which is not so ideal for charcoal toothpaste. So let's just stay away, at least for now.
Coffee or tea, which is worse for your teeth, do you think?
Both can stain. Both can stain. I would say black coffee and tea would be similar.
Yeah.
Milk coffee is probably a little bit less
Lesser.
staining. This is just my experience. Even green tea can stain.
Okay.
Yeah,
Sugar-free gum, friend or foe?
friend. As long as it's not overdone.
Overdone.
Yeah.
Using a toothpick, which is the commonest way people, again, you have all the restaurants handing out toothpicks after
Yes.
we had done, right? So do you, is it good practice, bad practice?
It is dangerous.
Dangerous?
Yes.
Okay.
So what happens is people try toothpicks to fish something out and they end up poking the gum. They end
Yeah.
up causing an injury. It's very common. We see it all the time. So we tend to avoid toothpicks. If something is stuck at the restaurant, provided you're not too far from home. Just go home and floss it out or brush it out or use a water pick or whatever it is to get it out. But try to avoid the toothpick. You have to be extremely careful. And as we get older, dexterity is also reduced. So, how good or how successful are we going to be at exactly fishing it out and not stabbing the gums? These are questions to be
Very
asked.
questionable. How many times a day should one ideally brush?
That's twice a day. Yeah.
Twice a day. One food you wish everyone would stop eating for better oral health if it were up to you.
Probably very sticky candy, like sticky chocolates, which tend to stay in the mouth for a long time. But even more than that would be your carbonated beverages, your sweetened carbonated beverages, which definitely should be avoided because firstly, it's the consumption time. Okay, it's not going to be had immediately. It's going to be sipped over some time. And then it forms a coating on all of the teeth. It's very sugary, those drinks. So it is something which I would say probably over the candy, I would say the
choose
carbonated beverages.
So it's all your
And it's
soft drinks.
all your soft drinks. And it's also acidic. So all kinds of problems.
Double hit.
Yeah.
One food you would recommend for strong teeth.
Generally, fibrous foods are better. Fibrous foods also have a cleaning action. So anything which is high in fiber content is going to be a good thing to have.
A dream celebrity smile, according to you.
The problem is I know the secrets behind those smiles.
Smiles,
So
okay.
I can't
Okay,
really
natural
say.
or manufactured, it is okay.
I don't want to comment on this.
Okay.
Yeah.
If your teeth could talk, not your teeth, if teeth could talk, what would they say, do you think?
Don't take out your aggression on me.
Okay. Probably help.
Yeah.
So probably with the way we treat them. One dental tip you think everyone should remember for life?
It's two. It's only brush twice a day, and it's every 6 months visit the dentist. I think that's all most people need. And if you're really good at it, add the flossing or the water flosser, and then really your dentist is going to shake your hand and congratulate you every 6 months.
Okay. So favorite dental myth you'd love to bust?
I think it's to do with baby teeth. So baby teeth, a lot of parents seem to think that baby teeth are going to be replaced by the adult teeth anyway. So if a baby tooth has fallen off very early because of a cavity and not according to the schedule which is appropriate for the age of the child, they don't think it's a big deal because why? There's adult teeth are going to come in anyway. The baby teeth are essential for chewing. Okay, they are essential for proper speech development. And very importantly, they are a space maintainer. They hold the space, the real estate of the mouth. They hold it for the adult teeth which is coming up. If it goes too early, other teeth in the mouth are going to collapse into that space. As it collapses into the space, now the other adult teeth are going to erupt at some point and there is no space. So they go cross, they grow sideways, they grow rotated. And then we require to do orthodontics, which is aligning these teeth when the kid turns 10, 12 years old. So baby teeth are very, very essential. We take them very seriously. And the only time when we are okay to remove a baby tooth is when it is time because of the eruption schedule. There are certain teeth which come out at certain times. That's when the baby teeth come out.
Okay, that's interesting and something I didn't know. Root canals, are they safe or are they dangerous?
Root canals have been widely practiced for now maybe 100 years and have found to be extremely safe. Okay. There has been some misinformation recently, some random documentaries which fortunately have been banned because it had no backing in evidence, saying that root canals are unsafe. Okay. It is probably the best way to save a tooth which has had very extensive decay or which has had some kind of problem at the tip of the root where there's an infection, or they've had trauma. Sometimes a person falls, you'll notice the tooth becomes brown. That's because the blood vessels rupture. But that tooth is essentially dead at this point, and the root canal is what we do is we remove the bacteria from inside the tooth, fill it with a filling material. A root canal is nothing but a filling for the root. Whereas when we talk about filling, we talk about the crown portion of the tooth, which is what we all see is the crown portion of the tooth. That is a filling, what we talk in this traditional sense. A root canal is just a filling for the root. But it has gone through controversy because they're like, oh, you're doing a root canal and you're keeping this dead object inside the body. But this is not truly a dead object. Yes, it doesn't have nerve supply because it has been cleaned out in the root canal procedure along with the rest of the bacteria. But there is still blood supply because the tooth is still within the bone and the blood is still supplying it. And I will say this 1,000 times, but a tooth is the best thing you can have. An implant is the second best thing. An implant is a replacement for missing teeth. An implant is not a replacement for a tooth. And there is this whole trend nowadays where dentists are aggressively removing all teeth and replacing them with implants. It used to happen in medieval times where as a wedding gift, what they used to do was to the bride, because cavities were a problem, painful, etc. The wedding gift was extract all your teeth and give you dentures.
Oh my God.
This was the wedding gift. So you don't have to deal with cavities ever. This was actually a thing in medieval times. It kind of feels like we're going back to that. We're saying extract all your teeth and place implants because you won't get cavities, you won't have problems. Implants have their own problems. It is not that they are problem free at all. Okay, but again, the marketing around all these things is going the wrong direction, I would say. Yeah.
That's interesting. And and that sounds absolutely scary. Pull out all your teeth before your wedding
Yeah.
and have the perfect smile and all your perfect teeth. My
Yeah,
God,
but
that
it's
is
a
taking
denture.
things to extreme.
You
I
have to
would
take
say.
it out at night.
Yeah. Any future plans to wind up for you? Because I think you inaugurated your teaching institute very recently, and I saw the facility reels on the reels posted on your page, and the auditorium looked excellent, I would
Thank
say.
you. Thank you so much.
So, what are you teaching, and is it a passion for you?
So both my mother, Dr. Lakshmi Acharya, and myself, we enjoy teaching. We have done quite a lot of courses on practice management uh, because my mother's practice this November actually is 51 years old. She continues to practice and practices more than me, I would be honest. And we like to teach implant dentistry. We like to teach cosmetic dentistry. Tomorrow we have a course on cosmetic dentistry with another faculty. So the center is used for dental continuing education, where we do short-term courses. It could be 2 days, 3 days. It could be a modular format where we do, let's say, a module for a week. 3 months later is the second module, depending on the content. But the facility itself is not limited to dentistry. So any company that wants to hire out the auditorium, for their private use, that's also something which we are open to.
Yeah, I think it looked very nice, and I would definitely get in touch with you if I decide to do something.
Absolutely,
And for
please.
a
You're
larger
welcome.
crowd, I would say.
Yeah, it's an 85-seater auditorium. Besides that, we have a simulation lab. So dentists, when they have to learn, let's say, how to prepare a tooth or how to do like a new technique, we need to learn on models, and those models are called typodonts. Now, there's no point in teaching a dentist to hold the typodont like this with a drill and do, because this is not reality. So this model has to be fit into something called a phantom head. Okay, so it's like a fake head, like a fake patient, and then that gives the real effect
Feel of it, yeah.
Because if you remember, dentistry for us, 50% is direct vision when we work on the lower teeth, but 50% is indirect. When we work on the upper teeth, we are working with a mirror. So left is right, up is down, everything is different when you work with the mirror over here. So that is something which we want the students to get the experience for.
Feel off also.
Yeah, so that simulation lab, we have 25-seater over there to train dentists in advanced skills.
So that sounds excellent. So best wishes.
Thank you so much.
So any final message to our listeners today?
I think we've covered the length and breadth of what should be done so that your 6-month dental visit is pleasant and not a shocker. I think if we follow these instructions, these very, very basic instructions, I think it's going to be a very smooth ride anytime you have to go and visit the dentist. And you will actually look forward to the appointment because you're going to get a lot of compliments. Who doesn't like hearing their dentist saying, I have nothing to do for you. I don't even have a clean. I have those patients. I have nothing to do for you. I don't even have a cleaning. Go and enjoy your life.
That's very nice. Yeah. So, yes, and I think what I would have taken home from this episode and preparing for it is, Marakama, I should brush my teeth in the night and make sure everyone in my family does that. and I should also be more proactive about going for these preventive dental checks. Advice is not only for others, for us also ங்கிறது is something I have taken from this episode. So thank you so much for your time.
You're welcome, Dr. Priya. Thank you so much for having me.
Thank you. So the mouth, it greets the world first and reflects it back to us. It's where nourishment begins, conversation flows, where every laugh, word and whisper begins its journey. But beneath that smile lies a deeper story, one that mirrors your hormones, your heart, your health. So honor it, listen to it, and remember that caring for your mouth is caring for your whole being. I'm Dr. PriyaKalyani, and this was Femiliarise, the gateway within. So until next time, stay curious, stay kind to yourself, and as always, let's keep the conversation going.